Good afternoon, and let me introduce my PhD topic with the title Optimizing Radiotherapy in Pediatric Brain Tumor Oncotherapy. My name is Renáta Kiss-Miki. I'm a first-year PhD student at the Semmelweis University, and my vision is to help the pediatric brain cancer patients and the researchers to improve the quality of life. For this, my mission is to give a better life with less side effects for pediatric brain tumor survivors. I'm running 2 projects in this field, in both of them investigating different types of radiotherapy, the efficacy and side effect profile of them. In my first topic, by performing a systematic review and meta-analysis, I am investigating the survival rate and the toxicity of the 2 major types of radiotherapy, the proton and the photon one. But why is important? As we know, childhood brain cancer is a huge challenge in pediatric oncology with a high impact of the quality of life. And based on the American Cancer Society, annually 4,000 new diagnoses are for these children. And more than 80% of pediatric brain tumors require irradiation to provide optimal survival. And as we know, this radiotherapy have a lot of irreversible life-threatening side effects. So our aim is to find the least harmful yet effective radiotherapy modality for pediatric brain cancer patients. But what is the difference between the photon and proton radiotherapy? Photon radiotherapy uses X-rays or gamma rays. The radiation affects both the tumor and the surrounding healthy tissue, but it's commonly used, widely available, and suitable for various types of tumors and locations. On the other hand, the proton radiotherapy uses charged particles. These particles are precise targeting the tumor and sparing the healthy tissue, and is beneficial for tumors near critical structures and for young patients, but it has a limited availability and may require specialized facilities. So based on this, our clinical question is which irradiation method is the least harmful, still effective for children treated with brain tumors. We enrolled children with brain tumors, compared the 2 major types of radiotherapy, the proton and the photon one, and measured the survival and frequency and severity of side effects. Our hypothesis is that radiotherapy methods that uses photon beam improves the survival and decrease the number of adverse effects compared to the other types. We performed a systematic search at the end of November last year in 4 databases with this search key, and after the selection and reference checking, we get 29 articles eligible for data extraction and for plots. Here you can see the list of my outcomes. As you can see, many outcomes were accessed and available in the articles. And as outcome measure, we use the odds ratio with 95% confidence interval and mean difference. If odds ratio is equal with 1, it means that there is no difference between the radiotherapies. If it's lower than 1, it means that proton is beneficial. If it's higher than 1, it means photon is beneficial for children with brain cancers. And in the upcoming slides, I would like to introduce some of our results. In the first plot, you can see the 5-year overall survival, one of the most important outcomes from our analysis. All of the included studies are retrospective cohort studies with a homogeneous population, and around 500 patients were included in this plot. The odds ratio in this case is 0.80, which is a statistically not significant result, but clinically we can say that proton radiotherapy can increase the 5-year overall survival rate. In the next slide, you can see the hypothyroidism, one of the most frequent adverse effects from the endocrine group. Here also retrospective cohort studies were included with 900 patients and a heterogeneous population. Here you can see a clear effect with an odds ratio equal with 0.17, which shows us that by using the proton radiotherapy, there is a 6 times lower chance to develop hypothyroidism than in case of photon radiotherapy. From the neurocognitive decline group, the IQ level, one of the most frequent tools used in the articles, we use the mean difference as measure of effect. And in this case, we can see that by using the proton radiotherapy, we can get 12-point higher points on different scales than in case of photon radiotherapy. Anemia grade 3, one of the hematological group, is a very common outcome in the articles, and it is very used in clinical fields as well, because at this level it is very common that the radiotherapy is stopped. So in this plot we also included retrospective cohort studies. In this case we have a heterogeneous population, but the odds ratio shows us that proton radiotherapy can minimize this side effect as well. And in the last slide with results, acute side effects are included nausea and vomiting, one of the most frequent adverse effects from this group after radiotherapy. And in both of them, we have an odds ratio equal with 0.30 and 37, which shows us that by using proton radiotherapy, we can minimize these side effects as well. The strength of our study is that only comparative studies are included with a high number of outcomes and high number of population in the studies, and many types of tumor are enrolled in the analysis. The limitations are that low number of articles, the missing data due to data collection, the different follow-up periods and the follow-up protocols, and also the presence of moderate and high risk of bias. So in conclusion, we can suggest the use of proton radiotherapy to reduce the toxicity and increase the overall survival. And as an implication for practice, we can highly recommend the implementation of more proton centers and also a longer follow-up period for proton to highlight the efficacy and side effect of this modality. As an implication for research, more two-arm comparisons and more studies to investigate the side effects based on the CTCA scale level, it's recommended. Here you can see the status of my manuscript. We are planning to send till the end of the month to internal review, and we would like to submit in a radiology journal, a D1 journal. In my second topic, by performing a registry analysis, I am comparing doses and side effects of radiotherapy in pediatric central nervous system tumors. As we know, there was a huge development and advance in radiotherapy modalities, resulting in promising outcomes in tumor management. And let me remind you just a few types of radiotherapy modalities that was developed in the last year. For example, intensity modulated radiotherapy, volumetric modulated arch therapy, and stereotactic radiosurgery. In this project, our aim is to investigate the side effects of different irradiation doses among children with central nervous system tumors. The clinical question is, what is the minimal yet effective dose that reduces the neurological side effects after the treatment? We are enrolling children with brain tumors from the National Childhood Cancer Registry and comparing radiotherapy dosages and measuring the neurological side effects. The hypothesis is that lower radiation doses can minimize the neurological side effects with retained efficacy. And we are doing this to provide data for protocol establishment, because there is a lack of data, lack of protocol in this field in the literature. Here you can see the overview of my two projects. I would like to finish both of them by the end of the year. And let me finish my presentation with my favorite quote from Erwin Lázár: "Even the most impossible things have to be tackled sometimes, because the most wonderful human experiences come from them." And thank you for your attention.
It was a nice study with a number of parameters investigated. And in this presentation, you a bit overshadowed the significant results by declaring that some other findings which were not significant, so which were not really findings, are also higher or lower. So hypothyroidism, for instance, or IQ, these are important new observations within this meta-analysis, and it should be highlighted. But when the confidence interval doesn't support the significance of the observation, then probably it would be better not to say that higher, lower. Especially, I noticed confidence interval 0.05 to 2 point something. So a 50 times range within the confidence interval, which means that these data really doesn't allow any conclusion to be drawn. You are aiming journal with 29 impact factor points or something like that. You should be careful when formulating your sentences because most of the reviewers wouldn't like it if they read that it's higher and lower when the confidence interval does not support this statement.
Do you have any data about survival? I mean 1 year or 10 year survival probability? Maybe you just showed 5 year survival probability. Thank you.
Thank you very much. Yes, in most cases in the articles there was available the 5-year overall survival rate and also a Kaplan-Meier curves. And we collected also data from the Kaplan-Meier curves based on plot analyzer, and we have 3-year overall survival, 5 and 10-year overall survival rate results. And all of them shows the same as you see in the result part, the 5-year overall survival, that then, so in all cases the odds ratio shows us that proton radiotherapy can can increase the survival rate.
As a limitation, you mentioned that you have missing data in the data collection, and I'm wondering what are these exactly, or what do you mean by that?
Thank you for your question. Yes, we have to face up with missing data due to data collection. For example, in case of IQ level, only the last test results were reported, and the initial one was missing in all of the articles, so that was something surprising for us. And also in some of the articles, the follow-up period wasn't highlighted, or we cannot find data about that.
I would like to ask about the IQ test. How similar the tests were compared in the study, or were the cognitive functions similar or identical, which were assessed there? Can you please tell a bit about this? Thank you.
Thank you very much. It was a discussion between us with the statistician to use mean difference or standardized mean difference, because you know there are a lot of tests, for example, accessing the IQ level, but all of the tests are correlated with each other, so it wasn't a problem to use the mean difference instead of standardized mean difference. And this was mentioned also in the articles where we collected the data, so it was accessible, and it can be pulled together, all the data.